Hello, I'm Dr. Bezic, and I would like to share a couple of tips about prevention of cavity. Now, everyone knows sugary drinks, avoid them, brush, floss, that would be helpful. And the common information is that as much as you keep your teeth clean, you're going to avoid cavities, as well as anything that it would be causing acidic environment. Now, unfortunately, with the diet of nowadays, we are on the run, most of us, especially our young kids. I noticed that the rate of cavity in children is much higher now than what I was expecting or seeing 20 years ago. Partially, I think that comes from the type of drinks that we are using and avoiding the tap water, which was fluorinated for that purpose. So you can use bottled water. I know most of us are like more filtering water, preferring to use that. But there are types that they have fluoride in them. Now, you don't want to consume more than needed fluoride. That's why the regulated water, wherever you are, if it is would be the best to use. Now, after any meal, any drink, emphasis on the drinks, because I know myself, I pick up my coffee and then I drink a sip and then goes another hour, another sip. That's the worst thing you can do because you're having the contact time prolonged of the acidic environment to your teeth. So to reduce that, I sometimes say like you can just have a whole pound of cake or sugar, but do it fast, eat it, drink, or brush and floss after. Now, not that I'm encouraging you to really eat a pound of chocolate, but keep that in mind that that would be less harmful rather than eat a small piece of chocolate, but then you do a little bite, little bite, little bite, take it an hour and being constant contact of your teeth. So keep that in mind. Brushing, flossing would be the best. Now, if you don't have the brush handy and you're somewhere, at least drink water. And the last thing being in contact with your teeth being water would be the best. Now, chewing gum, especially the ones that they have xylitol as their sugar, which is an antibacterial agent, would help. Now, don't chew for hours. You just need a couple of minutes, and you want to use it as a cleansing matter. So I know some of my patients, I need to talk to them about their muscle pain and joint pain with the chewing of gum can be increased, but for the purpose of cleaning, if you do it a few minutes after a meal, that would be a good help if you're not in an area that you can brush and floss. And one other important part that sometimes I notice that I need to remind, you might already know, brushing the tongue, cleaning the tongue is very important. The bacteria that cause the cavity, most of the time they nest on the areas over the tongue, that cleaning the tongue helps to reduce the risk of the cavity as well. I hope you learned something that you could use, and if you have any questions, if you're not sure about your condition and what you do, please check with your dentist. That's part of what we do, evaluating for the cavities as well as your hygiene technique and giving you some tips on how to prevent the problems. And if you don't know anyone and you like to reach us, Metro Dental Health, we have 2 locations, Fairfax and DC, and we'll be more than happy to see you. Thank you.